Thank you very much indeed, Vicky, and very much for inviting me today. Today's presentation has really been brought about by the impact of the pandemic, which, it's affected everyone and all of us within this situation. Being a man now nearly 50 years, but I will say in all honesty, I've never ever met anything like this before. I do recall in my early years seeing my first cases of malaria, of rabies, and I remember the introduction of HIV in the mid-80s, but never seen anything like this, which has changed the landscape. So I really want to take you through a presentation to look at where we are, but to really not just leave you with problems, but try and leave you with solutions for both individuals and also for your business. So if I go back to the World Health Organization, WHO, definition of health, go back to 1948, you can clearly see I've pulled out some words there which are pertinent today as they were in 48. And the words I've pulled out is about having information, active cooperation, involvement of the public, and of utmost importance, the health of people at this moment in time. But what we are faced with, and what I want to really get around at this moment in time, is where do you get that information from? And I think one of the things that's happened with medicine and medics and my colleagues, myself, over the period of the pandemic, we've been accused of changing our minds. We haven't. This is a new illness, a new virus. None of us have met. The science is changing, medicine is changing. We're not changing our opinions, we are developing them. But unfortunately, the mass media and politicians seem to have taken over the views of how they're going to manage this. So I really want to take you through some science, give you some hard facts, but try and keep it as simple as I possibly can. Now, why do you become ill? And for the vast majority of people who I've met as a physician over the years, their attitude is due to my genetics. It's what my parents gave me, and shooting your parents at this stage isn't going to alter that fact, and the rest of it is due to chance. But in fact, that really isn't the case. Genetics forms about 5% of your risk, and the rest of your risk is made up of a number of areas. And COVID-19 has really highlighted these areas, and all these are pertinent, particularly when we look at age and gender and ethnicity, huge impacts on people's risk of getting COVID and severe complications. Where you work, how you live, and the business support has also had a huge impact. But the biggest block that I'm going to talk about is about risk behaviours and lifestyle. I've heard speakers already today and on the previous week talk about weight and exercise and diet and smoking. Most people tend to think of these as things that really relate to heart disease, etc. Not the case, I'll show you in a minute. And finally, it's about how healthcare manages. And we've all seen over the period of time since January of this year that how our healthcare, and not just our healthcare, but healthcare across the world has really suffered. But I really want to pull out a couple of boxes for this. Now, your risky behaviours, 70% of your risk of becoming ill and also to having severe complications from COVID-19 is due to your lifestyle. So add the 7% to 70% to the 5% of genetics, the rest of it is due to what we would call the social determinants. But what COVID has also shown us that this is not a respiratory virus in the classical sense of a cold or flu. This is an immune system virus. This is one that we've never met before, never seen, and we're learning all the time. So in fact, we need to highlight these in order to minimize the problems we're getting. So again, if I look at the main risk factors we've got here, and I know and I can see that if you are over 65 and I'm over 70, you are overweight with type 2 diabetes, high blood pressure, and respiratory and cardiac problems, you're in a real mess and a real risk, and hence why we're trying to shield those people. So the risk factors are there, and a vaccine's not going to change those risk factors. But in fact, you can do something about those, both for yourself and your business. So let me just start and look at the world of well-being, wellness, whatever you want to call it. And I've called it BC. This is not before Christ, this is before coronavirus. And in short, ladies and gentlemen, well-being and wellness was not really on the business agenda in any real format, really real impetus, any real meaning, etc. It wasn't embodied in the C-suite, it wasn't top-down, mental health really wasn't there. And if we really were doing something, why were we seeing such a massive increase in obesity and the risks there? So in fact, we were all looking for how could we really justify for every pound we spent what the return would be. So I'm not going to dwell on that because a lot of this now becomes irrelevant and we have to move into a brave new world. So if I look at what the impact of COVID has been, and it's been massive, as I say, we have, and probably between 40 and 50% of people who've actually had COVID on the surveys that we've done across the general population here in the UK have had no symptoms at all. But 20% of the people have had significant problems, and particularly in the at-risk groups, we've seen a huge death rate that we've had there. We have no evidence, even those people who've been affected, that that immunity lasts. What we do believe from our studies is that any immunity confirmed that you've had from contracting the virus disappears at about a rate of 30% per month. So 3 months after you've had it, you've probably lost your general immunity. We know that there are variable recovery times, anything for a few days, and we suspect those who've been in intensive care and survived, their recovery time is going to be in years, not months. Significant impact. But we've also got this massive backlog of old chronic ill health issues because our health services have shut down, and a new block which we now call long COVID. And those people who are coming out of it are having long-term chronic problems with lungs, with hearts, increased number of diabetics, etc. So we've got a massive increase for our health service to actually cope with. Excuse me. We've got a massive rise in mental health problems and suicide from this. And going on from that, we can all see that our public health service, which was badly underfunded from about 2012 onwards, really has not done anything to help us. And just the struggles that we're having today, and you only got to look at the news broadcast to see we don't even have a proper track and trace system in place at this moment in time. So we're not testing, we're not able to do something. So we need to invest in that as well at the same time. The health service has stopped. Unfortunately, we're going to see a massive increase in problems with cancers we've not treated, heart disease we've not treated, etc. So the impact goes on and on. The economy will suffer. We have problems there. People are working in a new environment, etc. So really what I'm saying is at this moment in time, we have to move away from this and move from eliminating that virus. We aren't going to eliminate the virus. We're going to have to live with it. Even with mass vaccination programs, if and when the vaccine comes in, it's going to take us 2 to 3 years to vaccinate 6.5 billion, not million, 1 billion people across the world to actually do something. So the first time in sort of living memory for all of us, there is no playbook for this. Your organisers here and people asking me at various conferences, who's doing it well? We don't know. We're all in the same boat at this moment in time, and we have to move forward. So in moving forward to see where we're actually going to, what are the next steps? If you go back to my BC slide, I actually said we've all been trying to prove this benefit of investing in well-being, and will it come out as something positive? Well, I think what COVID has done has shown a clear link between health and economic health. So that has been proved in my mind beyond a shadow of a doubt. So what are the next steps that I want to take you through? I suspect this pandemic is going to be with us. It's not going to disappear, even with a vaccine, by Christmas into next year. The implications are long term. We've got to anticipate that you're going to have recurrent business shutdowns, and you need to be prepared for that. Case management has improved. We're better at treating people, so your survival rates. Initially, when people were sick at the early part of the pandemic, something like 80% of those in an intensive care unit would die. That's now down to under 15%. So we're managing better with new treatments, etc. We have got 124 vaccines in development. Probably 5 are well into what we call stage 3, and they're looking hopeful. But they probably will need more than one vaccine, depending on ethnicity, age group, underlying conditions. So we're far from a simple solution at this moment in time. We're seeing telemedicine, which the health service and your general practitioner said we could never do, working extremely well, and we will move into that and do some more as we go forward. People are coming back to work, and I hope that you are creating safe places to work for them. And that is no different to other health and safety measures that you should be putting in place. We need, and I keep going back to this, as much as we want a vaccine, and it will come, we've got to keep going with social distancing, using your masks and hand washing. This is by far 80% of the way that we will actually get in control of this virus. There's no other way around it. Excuse me, I just need a quick drink. Thank you. So we need to support employee well-being. We need to get those risk factors down. That's vital. So what are we going to do that? So what I want you to do is, if we can't change our circumstances, I want you to change your attitudes and behaviours and the way to approach this for you and your employees. It's vital that we do that. So we need to have some fundamental shifts as we go through this. So at the same time, what I want people to do is to look and see as to how we can help and support our people within businesses. I want you to really put this on the top of your agenda. I want you to make arrangements so that you can have well-being at the first and forefront of everything that we do. It's got to be lifestyle based. We've got to manage those risk factors, and we can manage those risk factors through a workplace point of view. And if we go on and do this, and mental health and physical health need exactly the same impetus. We mustn't devolve one from the other. I'd like you to talk about health rather than physical health and mental health. Exercise, diet, sleep, meditation, mindfulness, etc., will come first and forefront into that. And it's vital that we do that as well at the same time. And as we go forward, moving this into a place of work, you need to look at who's supplying you. You need a vendor that can actually address everything from physical health, mental health, social health, financial health. We need it all in one place, and your vendor needs to have increased flexibility more than they've had that before. A single platform, a single point of contact, simplicity and good communications, I believe, will be essential as we take this into the forefront of the new world of managing health, productivity, reducing presenteeism, reducing absenteeism as well at the same time. That support has got to come from clearly where you are going to do that and how you're going to manage it through. This new world is here for, I believe, ever and a day. The health service is going to struggle for a long time to come in the future, just with the backlog that we have at this moment in time. And clearly that isn't going to change. An investment in your managers, into actually managing mental health, recognizing mental health, supporting your employees will also be of value to where we go forward. And I think some of the things that I would countenance people to look into are just the boxes we put here. And it really has got to be that we've got to move medicine and everything else that we go forward into new ways of working, new ways of provision. Provided we do that, I believe we can have a successful forefront. But I would really encourage businesses to take this on as an essential part of their HR function, their manpower planning, their employee support. So it's no longer going to be a nice to have. It really needs to be an essential part of everything that we move forward. Now, I think a lot of the things that we've actually talked about in going forward, there's sort of a lot of gloom and doom around at this moment in time as to everything that happens around us. And I think what we have to do here is actually develop a greatest degree of positivity. I'll go back to Charles Darwin, and really a lot of what's gone in the past, and history does repeat itself. It is not the strongest of the species that survive, nor the most intelligent, but the ones responsive to change. We have to change. We have to move forward in healthcare, business attitude, and employee attitude as well at the same time. And I will also say that as it can be quite dark and gloomy days on occasions, I don't know what the outcome is going to be, but I'm being very positive. I'm positive that a vaccine will come along, or different vaccines. I hope we can get people to change their attitudes long term into personal care, lifestyle care, and again, social distancing, hand washing is the most important thing that we can go forward. But at the end of the day, it will be all right in the end. And hopefully we're going to get there in the not distant future. So hopefully I have left some time, Vicky, for some questions, which I hope you can facilitate on our behalf, please.
Thanks, David. Obviously some sombering facts and figures there, but equally, as you say, it's important to keep that positive focus on how this can hopefully improve well-being moving forward. I mean, just on that, I just wondered what your thoughts are, how you can, what can employers do to kind of keep that positivity, to frame those conversations in that way when there is so much kind of upsetting, depressing media reporting on the COVID-19 pandemic?
The most important thing is actually communicating with your employees, both generally and specifically. It's important that they trust you, that they can see that where their business is going, that you have procedures in place. Good employers are undertaking risk assessments and creating safe places of work, safe places of work that people can actually visit, and also actually looking at the home working environment as well at the same time. And that is a challenge for us all because it's come on very quickly. We've not had time to adjust or put things in place. But I think at the heart of it is about communicating top down. It's about a belief in your business. They need to understand where you're going. And I also start to train line managers, particularly around mental health and how they can recognize people who may be struggling, how they can be empathetic and sympathetic, how they can support them, and maybe direct them either to support that you may well have through an employee assistance program, through occupational health, or into their own healthcare providers. But I think communications will be top of my list.
No, absolutely. And I think another question we've got here is, with winter approaching, what actions can we expect from our health services, and what can we do as a business to help prepare both our own businesses and our employees?
Well, I think we don't know what's going to happen. It does appear from what we're seeing in terms of caseload at the moment, we are going into a second wave at this moment. And we know as we go into the winter that normal influenza season is approaching. So I think it's very important to still emphasize this social distancing and hand washing and hand care, etc., and masks. We know that that will prevent the spread of normal influenza and cold, so that will get it down there. Encourage people who are in your vulnerable groups or in their age brackets to go and get their flu vaccine, which they may well have never done before. That doesn't stop them getting COVID, but it reduces their risk of having two viruses at the same time. Get people to improve their lifestyle, exercise, diet, get the smokers to stop smoking, but above all, try and get people to lose weight. It is amazing just how the weight loss can go down quite easily. And I know we've all been putting on some because we've not been social distancing from the fridge as much as we should do it. But there's a lot that we can do. But it really is doing the things we're doing for COVID will actually reduce the risk of seasonal flu as well at the same time.
Brilliant, brilliant. I've got a question here from Dina Mystery. She says, our workforce is global and now working remotely. Have you got any suggestions on how we can communicate and engage staff and managers? She says, we've got lots of good tools and resources, but we're struggling to get staff to utilise the services, particularly the mental health services that we offer.
Problem is, mental health has always been a stigma. Mental health has always been that challenge because people don't like to talk about it, particularly men. And I think that's why I would actually start to put some emphasis on training your line managers, both in terms of how they communicate, the empathy, the sympathy. And it's about teaching them not just to speak, but to listen and to hear and to observe. Because quite often you'll see employees struggling, just the way that they behave and their performance and their attitude, etc. Now that, but it's often just a simple question like asking, how are you? And once you've that, then open a dialogue and then find a place where you can speak one-to-one with those individuals. But no matter where you are in the world, we're still dealing with human beings that all react the same way. So the same skills, but to me, line management training is probably, again, one of the key factors. I'll link that in with good corporate communications.
No, absolutely. So we've just got 30 seconds left. One of the things you mentioned in your talk was about providers and vendors having to increase their flexibility to be more adaptable and ready for this new environment that we're now working and living in. And I just wondered if you could just quickly sum up how Virgin Pulse has adapted to meet the current challenge and some of the things that you've done to address this head on.
We were already had a flexible platform where we could cover all the issues I talked about. But once COVID came along, I'm part of a science advisory board. We created a Virgin Pulse COVID toolkit, which gives an awful lot of information from risk assessments, managing your people at work. We've also created a scientifically validated return to work passport. So we encourage all our users every day to look at what's their temperature, do they have symptoms, to actually minimize that risk of going into work and infecting others around them, etc. So I and the other science advisory boards, we meet on a very regular basis, sometimes several times a week, to look at how we can support our individuals. But I go back, we have the flexibility to look at all aspects of physical well-being, mental well-being, sleep, meditation, financial advice, social advice, and at the same time, we put people in communicate. It's about having a body of people around you, self-minded people that you can commune and talk to with at the same time. So we've just done more and better and adapted at the same time.
Brilliant. Thanks, David. Our time's up. So I just want to say thanks for a really interesting and really candid presentation, and lots to consider. And I think I'm going to take your social distancing from the fridge comment to you, because I love that. Brilliant. So thanks very much. Now, just to let everybody know that the live vendor presentations are about to start. So please don't be shy, go along, find out about the solutions and latest developments that are happening, and enjoy the rest of your day. Thank you.